This is just a quick reminder. The main philosophy behind healthcare reform in Massachusetts was it was a shared responsibility. That it wasn't just government subsidies, it was individuals that had to take on responsibility for getting health insurance. Employers had to offer health insurance to their employees. The insurers also were giving up and regulated to a greater degree. And the key idea of Massachusetts was, to a certain extent, adopted at the federal level. It's up to everyone. It's not just the government that's going to solve this problem. Individuals, employers, insurers all have to contribute to the success of this. I won't go through the ways that that was the case, but it was, I think, an admirable approach. John mentioned that an exchange was created, the first exchange in the country, insurance exchange. This is the connector. And the connector in Massachusetts was created with the idea of providing the kind of services that John mentioned. And I'm just going to quickly mention what the result of that was. The result of that was 175,000 people received insurance as a result of the expansion of Medicaid or heavily subsidized care. 33,000 people took advantage of the connector to do that kind of Expedia, find out the best insurance that you could purchase with your own dollars by finding out information from an objective source. So the balance was more in terms of the expansion of Medicaid and subsidies in terms of the impact. Likely to also be the case in the states where where Medicaid is expanded. So what happened? What was the outcome in Massachusetts as we fast forward a few years after the passage of this bill, passed in 2006, implemented in 2007? I'm going to look at it across 4 different arenas: access to care, health, outcomes, cost, and public opinion. So I'm going to, and you know, when I was in government, I absolutely hated the idea that you ranked things and that you gave them the grade. We used to call it rank and spank. I hated it. 10 months into academia, what am I doing? I'm giving grades to things. So, you know, this is the strong influence of academia. So when I grade access, how did Massachusetts do in terms of expanding access? I would say give it a B+. Pretty good. This gives you some sense of what we were doing. We're the blue bars, and so we started pretty low in terms of the level of uninsured people in Massachusetts relative to the rest of the country. The rest of the country is shown by that line up above. So what you can see in 2006, when the bill was passed, we had about 6% of the state that was uninsured, and the rest of the country had about 15%. Of the country that was uninsured. We got, through our healthcare reform bill, pretty quickly down from 6% to about 2%. We're about 2% now. We're not going to go lower than 2%. So it's not universal. It's from 6 to 2%. Meanwhile, while we were doing that, the percentage of people in the country who were uninsured continued to rise. So we can be proud of that. That's something very much to be proud of. We also want to know whether or not it made a difference to have an insurance card. It's conceivable that people could have an insurance card and then not actually get care. So this was a survey that was done that looked at the percentage of non-elderly adults. We cut out people on Medicare because they already had an insurance card, so the ones that were going to be affected were the non-elderly. How many of them said that they had an unmet need for care for any reason in the last 12 months? And what we found was, when we looked at the year before healthcare reform was implemented to a couple of years after it was implemented in Massachusetts, that the percentage of Massachusetts residents who said they had an unmet healthcare need actually dropped. It dropped by 20%. That's good. It didn't drop by 90%, but it dropped in a measurable, statistically significant way. And importantly, it dropped across a wide range of different income groups, with among the sharpest drops being the low-income people. About 34% of the people before health care reform in Massachusetts said that they had an unmet need related to health care in the last 12 months. After health care reform, that dropped from 34% to 26% for low-income residents. So that's good. We had a measurable way of asking people, did you have greater access after health insurance was passed? We also were very worried that people might have a hard time finding a doctor, that there might be just shortages of doctors, they wouldn't find them at all, and that we wouldn't see any kind of a difference in terms of that. And there certainly were shortages and there were delays in terms of people being able to get a doctor's appointment. But we were happy to see that the statistics indicated that there was an increase in the percentage of the population in Massachusetts who said, yeah, I have a doctor. I have a doctor I see. And it didn't grow, it was already high, so it was at 87%. Because remember, we only had 6% without insurance. But we went down from 6% to 2% uninsured, and we saw, again, a statistically significant increase in the percentage of people who say, I have a regular source of care, I have a doctor. And that is much higher than the national average. And so we're the best in the country in terms of, you ask people, do you have a doctor? Or you see a doctor on a regular basis. This is just another way of asking that question. We asked for non-elderly adults, did you see a doctor? Did you actually see this doctor in the last 12 months? For people who had health insurance in Massachusetts, about 85 or 86% of the population said, yeah, I actually saw my doctor in the last 12 months. How many of you have seen your doctor in the last 12 months? Okay. If we asked that question in Mississippi, we would not get that many people raising their hands. In fact, if we asked that question in Massachusetts, for the 2% of the population that still don't have health insurance, only half the people would raise their hand. So for those 2%, those are the bars over on, let's see, your right. Only about half of the people without insurance, the 2% that lack insurance, actually say, I saw a doctor in the last 12 months. So that's a sign that having an insurance card really makes a difference in terms of access to a doctor. You might say, well, maybe they were just healthier and they didn't need to see their doctor. The data indicate that, in fact, they're less healthy. They're more likely to be in poor health. So not having an insurance card definitely indicated, we saw evidence made a difference in terms of people not being able to see a medical provider. We also were worried that maybe what would happen with healthcare reform would be people would just be paying more out of pocket. Why would they pay more out of pocket? Well, maybe there would be co-pays and deductibles that would just go up in price, and that would mean that the cost of care actually increased because they had health insurance, but they had to pay higher co-pays and deductibles. So this largely measures co-pays and deductibles, and the indications there, not to go into detail, are the Massachusetts residents say they actually were paying less money after healthcare reform in terms of co-pays and deductibles afterwards. Now, I'm sure there's someone in the audience who will say, I know I paid more, but this is like a telephone survey of thousands of people. So, this is also an important chart. This chart looked at whether or not the impact of having access to health insurance was experienced by the different race and ethnicity populations within the state. And if you look at the section of maybe about 2005, 2006, what you see there is that the green line represents Latino residents of Massachusetts and the percentage of those residents who lack insurance. And it's more than 20% of the Latinos in Massachusetts said they didn't have insurance in 2005, 2006. Remember, only 6% of the overall population, Latino population, more than 20% lacked insurance. The line below that, the blue dotted line, represented the African American or black residents of the state. Those residents of the state were next highest in terms of lacking health insurance. And then the purple line at the bottom represented the white residents. So what do you see when you look at 2005, 2006? You see a very significant gap between the white residents of the state and the black, and especially the Latino residents of the state, in terms of who had health insurance. We are very pleased to look at the right side of the chart, where we get closer to the post-healthcare reform side, and what that indicates is that there's still a gap, but that the gap has closed significantly. For the black population of the state, the gap has almost disappeared in terms of the percentage of the population that lack health insurance. For the Latino population, it hasn't disappeared, but the gap between white and Latino has narrowed. So that's a positive sign. It would be more positive if it disappeared completely, but it's moving in the right direction. This is just another way of looking at that. This looked at the same question we asked earlier about, do you have a usual source of care, and have you seen a doctor in the last year? And if you look at the fall of 2006, you see that there was a difference between the light blue, white residents of the state and the black bars representing the people of color in the state, that there was less access, as indicated by did you have a regular doctor and did you see the doctor in the last year. And if you look at the post-healthcare reform 2009 bars and charts, basically a lot of that, if not all of it, disappears in terms of the gap between those different populations. This doesn't measure Latinos though. So this is an important chart to remember, because around the country, very often people say, Massachusetts has universal health insurance. Well, we have 98% of our population. 2% seems like a very small percentage. 2% of the population in Massachusetts is 120,000 people. So that's a lot of people. So if you're one of those 120,000 people, it matters to you that you don't have health insurance. And who are those 2%? Well, they're disproportionately male, Latino, non-citizen, low income, and not working full-time or unemployed. And if you see the percentages in the bars, about 4% of the Latino population now says it's uninsured. Better than the 20%, but 4% is double what the percentage is of the uninsured that are white. So we still have a ways to go, but we've made progress, and we need to pay attention to those gaps. This is just another way of asking, this is the final chart on access, and the question was, did you need health care in the last year and money was an obstacle to your getting that care? For the 2% that didn't have insurance, 2/3 of them said yes. For the 98% who did have insurance, 1 in 4 said money was a factor. And that's co-pays and deductibles, and just a reminder that those can become barriers to care. The fact that people with insurance, 1 out of 4 said money was still a barrier for them in getting the care that they needed. Okay, that was all about access, B+. So then, this is a critical and often overlooked component. This is, did people actually get healthier? Because ideally, we don't want health insurance simply so that you can say, I have a doctor. We want to see, do you have, does having access to health insurance result in an improvement in your health? Here I think the indications are probably a B. Pretty good signs that there were in fact improvements in health. We don't have the best markers for that. This is one marker. This was a marker that says to people in these telephone surveys, again, thousands of people were surveyed, did you get preventive services? Did you get a flu vaccine? Did you get did you get assistance in giving up smoking? Did you get something that we can probably correlate with ending up, if you got that, probably improved your health? And for the 98%, 3/4 of the people say, yes, I didn't just have a doctor's visit, I actually had a preventive visit. I got some preventive service in the last year. For the 2%, only 1 in 3 said they had access to that, could have been a flu shot, etc. This gives you some sense, again, that this is just another measure of that. Indications are preventive care is improving in Massachusetts as a result of healthcare reform. This gives you some sense of what the screening was like. And some of this is not just screening, it's also prevention. So look at colonoscopies for a moment. Colonoscopies are recommended for people only above a certain age or with certain health risks. Colonoscopies are not cheap. And if you're uninsured, you're very unlikely to say, I really just want to get a colonoscopy. Because it's going to, cost a lot of money to get a colonoscopy, and it's not the most pleasant test to get. So people who are uninsured, by and large, don't get them unless there's something very seriously wrong and a doctor's testing it to find out what it is. So, well, not surprisingly then, when we suddenly had more than 400,000 people, about 420,000 people get health insurance after healthcare reform, we saw a statistically significant big jump in the percentage of people who got age-appropriate colonoscopies. That, by the way, is twice the percentage of the overall country over a 5-year period. So the country was slowly, moderately increasing colonoscopy. In Massachusetts, twice that percentage in just a year or two. And by the way, colonoscopies are not just detecting that you might have colon cancer, they're preventive. So if you have precancerous polyps, they can be removed. You can actually prevent colon cancer if you do colonoscopies, and it's able to detect a precancerous polyp in time. So it's a good indicator of an intervention that may result in improved health. Here's another thing, we didn't expect to see this, but in Massachusetts, part of healthcare reform actually said Medicaid in Massachusetts, the Mass Health Program, as part of Massachusetts law, has to offer, for the first time, smoking cessation benefits. Surprisingly, before healthcare reform in Massachusetts, they weren't offered. They were offered in 2007 or 6, and what we surprisingly saw was a dramatic decrease in the percentage of people who were on Medicaid who smoked. That purple bar is the percentage of smokers on Medicaid. It went down very dramatically. Within the first year, this was, the services involved in smoking cessation were widely taken advantage of by Medicaid recipients. We then went further than that, and we looked at, I don't think I have this on a chart, but I will tell you. We then decided that we would look at, is there any evidence that makes a difference? Because we think, okay, that makes a difference, yeah, that's good. Stop smoking, of course, nobody should be smoking. But maybe we won't see any difference in terms of people's health for 15 years because we'll see lung cancer going down. Surprisingly, we did a study where we looked at the Medicaid claims, and we looked at utilization of health care, and what we found is looking at that population of Medicaid recipients with a demographically similar and population with same health indicators. What we saw was within 18 months, the Medicaid recipients who gave up smoking had a statistically significant lower number of heart attacks and visits to the emergency room for respiratory illness. So that's 18 months. 18 months after giving up smoking, real savings, real health improvement, and we can tie that to Massachusetts healthcare reform. Here's another indication of better care. We talked to diabetics. So with people with diabetes, who represent 8% of the Massachusetts adult population, there are only like 4 things that are considered preventive for diabetics. There are things like flu shot, foot examination, eye examination, and an A1C test. Only 12% of diabetics in Massachusetts before healthcare reform said they actually got those 4 things. They're not complicated. Those are 4 things that are part of the clinical guidelines. What we did see, which was good news and bad news, post-healthcare reform, it jumped from 12% to 19%, so about 1 in 5. I mean, bad news is, why isn't it 100%? But the good news is, it wasn't going up at all before healthcare reform. And so we think that that's a good sign, and that the likelihood that that results in less complications for diabetics is strong. This is related to health that I would just say is a side benefit. The side benefit of clearing the way in terms of having the discussion about access, getting that kind of off the table in 2006, 2007, cleared the way for a lot more of the discussion and focus in Massachusetts to be on both quality and cost. And so I was in government then. In 2007, 2008, we did quality campaigns about healthcare like we've never done before. $400 million is spent a year in terms of treating hospital-associated infections in Massachusetts. 400 million. Those are infections that people got while they were in the hospital. And so we began in 2008 a major campaign around reducing those hospital-associated infections that virtually every hospital in the state has been actively involved in this. If you've been in a hospital, you now see and maybe take for granted the hand sanitizers, the signs that say wash your hands. That all arose in large part because we kind of cleared the deck in terms of access and focused a lot on quality. In part because focusing on that kind of quality reduces costs. So I would say unexpected but strong result of our healthcare reform was the ability to pay more attention to that. We also paid much more attention to primary care medical homes. If everybody's 90% have a doctor, we wanted that doctor's experience not to simply be, I have a doctor, but to create an experience where the model would be a comprehensive medical home. And there's been a significant amount of work on that, which I'm not going to go into. But it's improved in part because healthcare reform in Massachusetts allowed us to focus on it. Here's the troubling indicator, and that's cost. Some people would say it should be a D or an F. So this is C+, and the reason I'd say C+ is because it was a disaster before healthcare reform in Massachusetts. What's happened since healthcare reform is now there's a lot of attention to what can be done to make a difference. This is just long-standing. This is Massachusetts. We are the worst in the nation when you look at per capita health spending and premium costs. Look at the slope is from 1980 on, so very high. It's been that way for a long time. It remained that way after healthcare reform in Massachusetts. The years after healthcare reform, we saw very high costs and premiums continuing. Not jumping up, but just continuing on that slope. This looks at something we saw that was also concerning, and that was we did increase the number of people and the percentage of the population on Medicaid because we increased Medicaid eligibility. So we were seeing very concerning increases in terms of Medicaid expenditures. So there was a need then to shift some of that focus to what we could do on cost. Almost immediately after healthcare reform was passed, there were a lot of non-governmental as well as governmental steps that began to be taken to creatively think about what could be done to control those costs. This first bullet may surprise you. Most primary care doctors in Massachusetts, or at this point, have some form of global payment for their reimbursement. John was talking earlier about moving away from fee-for-service to global payment with the hope that that would move us away from just paying only for volume, but thinking more about how can we keep people healthy. In Massachusetts, we've been experimenting with that for the last number of years, and it's promising. In about 2 or 3 weeks, we're going to hear from Andrew Dreyfus, who's the executive director of Blue Cross Blue Shield. Come back for that session. Andrew's going to talk about the, I think, remarkable role that Blue Cross Blue Shield has played in terms of designing an alternative contract which moves strongly in this direction. The bottom line, I think, is some of these efforts have already begun to make a difference. Oh, I forgot to mention the Division of Insurance. Governor Patrick said to his Division of Insurance, if we're going to continue to see these double-digit increases in premiums, we're not going to approve them. So he basically said to the Division of Insurance, if the insurance companies come in and they say they want to increase the premiums 12%, 14% like they have been doing for year after year, turn them down, because they have to get approval from the Division of Insurance. And so he began to, so the Division of Insurance started saying no, and in fact the premiums, the insurance companies often went back to the drawing boards, and then they would come back later and say, okay, it doesn't have to be 14%, maybe it'll be 5% or lower. So we're beginning to see some of that kind of change with government intervention and with private sector innovation, like with Blue Cross Blue Shield. And it's made a difference in terms of the measurement outcome. Massachusetts now, instead of being number 1 in terms of premium cost, is number 9. We'd like to be lower down in terms of that, but moving from 1 to 9 is progress. And then a very significant bill was passed last year. It's known as Chapter 224. I wish it had a better name than that, but it doesn't. But it's the Cost and Quality Bill. And it did such things you may have read about. It's created some state agencies that look at the cost of health care and really try to monitor whether or not the cost of health care is increasing faster than the general economy is growing in Massachusetts, and whether or not overall the cost of living is going up, and making the case it really shouldn't be growing faster than that. And monitoring it carefully with the idea that if there is that continual gap between what the general growth is in the cost of products and healthcare, then it will consider taking more action steps. Didn't decide what those action steps would be just yet. It also created additional incentives for some of those non-fee-for-service alternative payment methods, and it did a lot around payment transparency. You can easily get onto a website now and find out, well, how much does this procedure, a knee replacement, cost at, say, Brigham and Women versus the Carney Hospital, or Western Massachusetts versus Eastern Massachusetts? The thinking is transparency is helpful in terms of controlling costs as well. And finally, there was some medical malpractice reform that was done as part of 224 as well, in order to eliminate some of the pressures that doctors were under in order to treat defensively in fear of lawsuits. At the federal level, you heard that the Affordable Care Act created a trust, a $15 billion trust. Well, in 2012, we created a trust in Massachusetts, much smaller, but still a groundbreaking one. The legislature said, we believe that another way we can control cost is by keeping people healthy. Let's try it. So they voted for a $60 million trust. That's $60 million over a 4-year period, so figures something like $15 million a year, is specifically to give out grants to try to improve the conditions in patients' lives or to coordinate care clinically with what's happening in the rest of their lives around housing and park availability and the foods that they eat, and to see if that can have an effect on reducing costs. The state has just released that money, and before the end of the fiscal year, before the end of the calendar year, they should probably be announcing how they're going to distribute the first close to $15 million. I won't go into financing. Okay, I think I'm just going to go into public support. You know, it's controversial in Massachusetts, it's controversial in the country. We're a pretty split country, about 50-50 about healthcare reform. In Massachusetts, it's pretty popular. One of the areas that we thought would be the most controversial was the individual mandate, very controversial in the rest of the country. Now, in Massachusetts, it's just no big deal. 99% of the public in Massachusetts complies with the individual mandate to have health insurance. 99%. And if they don't comply, they pay a tax penalty. They could potentially pay a tax penalty when they file their state income tax. But even there, it's a relatively small percentage. There's some ways of making the case if you're low income that you couldn't afford to do that. So it's a very, very small percentage of the population that aren't in compliance with the individual mandate. If you have the public deal, is healthcare reform popular? Right about the time it was passed, it was about 2/3 of the population. About 2/3 of the population still say, yes, I support the Massachusetts healthcare reform legislation. In Massachusetts, 2/3 support is like a landslide, you know, in an election. You get, you know, that would be considered very popular. But basically, there's no one Republican, you can't find a Republican at the State House who's talking about repealing the Massachusetts healthcare reform bill or even criticizing it very much. It's a very popular bill. And this just looks across the various populations within the state and finds it's quite popular across different demographic groups. So here's the summary. Here's the last slide. You know, the take-home messages in terms of access. The healthcare reform bill in Massachusetts really achieved much of what it wanted to achieve. The concern there is we still have to pay attention to gaps. Those 2%, 120,000, we can't forget about that. And there are some gaps in terms of what's called churning, people who have insurance and then they lose their insurance or they change jobs and at the periods of time they don't have it. That needs to be paid attention to. But we've made great progress in terms of access. Cost, not so much. But right now, it's a big priority, and a lot of different forces in government and non-government in Massachusetts are paying attention to this, much more so than in most of the rest of the country, because we're actually thinking, rolling up our sleeves and coming up with concrete strategies to try to rein in costs. Health, strong indicators, health is improving. We want to keep paying attention to that. We want to see if we can help the national implementation of healthcare reform and see if they're also seeing it. Support's been strong. The impact, I think, you know, clearly had the Massachusetts bill not passed, it would have been questionable whether or not we would have had the Affordable Care Act nationally. And just unresolved, I think, are these questions about, will we actually get costs under control? Will we ensure that we get highest quality care possible? And can we enclose the gaps so that some of the most vulnerable people who still are not getting the care they need have access to that care?